Hey, Dr. Rutledge. Today I'm going to be teaching you a little bit about Staphylococcus aureus. Um, so here it is. This is staph. This is a gram stain. It's gram positive. You can see that it's in these grape-like clusters. Here's staph on a blood agar. You can see beta hemolysis here. And then here's staph on mannitol salt, and you can see that it turns bright yellow as it ferments that mannitol sugar. So Staphylococcus aureus is a gram-positive cocci, and it forms in grape-like clusters. And what makes it a part of the family Staphylococci is its 16's rDNA sequence. That's one of the main requirements into that family. Staph is an opportunistic pathogen, meaning it's part of our normal microflora, but when it finds an opportunity like broken skin, then it'll take it and it will become pathogenic. It is halotolerant, meaning that it can withstand high salt environments, such as like your skin or sweaty skin, and it can withstand that more so than a lot of other microorganisms. It is a facultative anaerobe, and it grows best at body temperature. It can range anywhere from 18 degrees Celsius to 40 degrees Celsius, but 37 degrees, which is body temperature, is optimal. Who is the likely host? It usually occurs in humans. It sometimes can occur in birds and mammals. Cattle can get it, like mastitis, like dairy cows. And if they get it, that can be detrimental to like the dairy industry. But it's usually found in humans, and it is a part of our normal microflora. 20 to 30% of the population is colonized, and that's usually in the anterior nasal passages or the nares. And carrying it in your nose is a key risk factor for infection, is at least 2/3 of those infections from S. aureus are due to autoinfection, which is like a benign colonization that turns to infection. And it's really more common in close quarters, close living conditions, or places like military barracks or college dorms or sports teams, where you're sharing those close quarters and maybe even sharing personal items. Some diseases that are caused by S. aureus are infection of the skin and soft tissue, things like impetigo, cellulitis, folliculitis, and these maybe start out as like a bump or something that looks like a spider bite, a pimple, or a boil. And they can be swollen, warm, or even painful to the touch. And these aren't super serious. They don't start out that way. And if you have prompt treatment with like cream or ointment or maybe antibiotics if it's progressed a little further. Some more serious infections of the skin and soft tissue are scalded skin syndrome, which is an infection actually not caused by the organism itself, but by the toxin that the organism produces. And that makes it looks like you've been burned, your skin, and your skin starts to slough off. That's the name, scalded skin syndrome. And also toxin from staph can cause toxic shock syndrome. Another disease caused by staph is staphylococcal food poisoning. And this is caused by ingesting food or drink that's been contaminated with the toxin. Like the example of the rotisserie chicken. You bring it home, you debone it, you've maybe had staph on your hands and you didn't know it, and you let it sit out before you refrigerate it, maybe come back to room temperature instead of putting it in the refrigerator hot. And then you put it in the fridge, and then when you go to eat it, staph the organism has given off its toxin. And so even if you heat it up, that toxin is heat resistant. And so it doesn't kill the toxin. And so you eat it and then you find yourself in the bathroom. Onset is pretty quick, but fortunately it has a rapid resolution also. You usually have symptoms for about a day, along with abdominal cramps, nausea, vomiting, diarrhea and dehydration because of the loss of fluids. So be sure to drink lots of fluids if that does happen to you. Another disease is staphylococcal bacteremia, and this is really serious. It has about an 80% mortality rate if it's left untreated. Symptoms are low blood pressure, fever, and chills. And this is when the infection has gotten to your blood. And this is really important to get this treated and taken care of as quickly as possible. And that's usually through IV antibiotics. Something like vancomycin, clindamycin, something that is going to get that infection, something that's really that Staph aureus is really susceptible to. Control and prevention, having good hygiene, washing your hands. If you would wash your hands before you deboned that rotisserie chicken, then maybe you wouldn't have ended up in the bathroom. Don't share personal items like towels, razors. Get prompt treatment of your infection, and avoid contacts with wounds or bandages of those who are infected. So if you're changing a bandage of someone who has a staph infection, a skin and soft tissue infection, be sure to wear gloves and wash your hands. Try not to touch that so that you don't become infected. And proper food handling. Refrigerating food within 2 hours, or if it's above 90 degrees outside, getting it in the fridge within an hour. Those things will help you decrease your risk of infection. So who's at risk? So these are health status factors that increase your risk of infection. People receiving dialysis, cancer patients, people with an HIV infection, those who've received an organ transplant, and those who use IV drugs. Those all greatly increase your risk of infection. Non-health status factors that increase your risk of infection are household contact with someone with infection, having an abrasion or a wound. If that's open, that is leaving yourself open to for the staph to become. It's an opportunity for the staph to penetrate the skin and create infection. Crowded living environments and towel sharing. This is a secular pattern of Staphylococcus aureus in the United States. Hospital onset versus community associated and healthcare associated. And you can see that we are in a downward trend, which is great. This is Staphylococcus aureus in the United States in different regions. The West, the Midwest, the South Atlantic, Northeast. And some of these, you have to remember population density for these, but this just gives you a pretty good idea of MRSA infections throughout the United States. So that was staph. If you have any questions, please let me know. Otherwise, have a great day.